picture this. You're out playing a casual game of football with some friends. The game starts getting intense, everyone's super competitive, and out of nowhere, bam, a player accidentally swings an elbow and it lands squarely on your cheek. For a split second, there's absolutely nothing, just an eerie silence in your head. And then, a blinding flash of intense pain. You know immediately something is really wrong, and suddenly everyone is staring at your face. We all know what happens next on the outside, the swelling, the crazy colors, but what exactly is happening under the surface? The biological story of what your body is doing in response to that trauma is absolutely incredible, so let's get right into it. Okay, let's start at the exact moment of impact. We're talking millisecond zero here. That fist, or in our case, the elbow, strikes your skin at tremendous speed. It is carrying a massive amount of kinetic energy. And in this tiny, tiny fraction of a second, a violent physical deformation cascade is already kicking off. Let's actually look at how this builds through the layers of your face. First off, your skin stretches violently just to accommodate the force. Then the layer of fat right beneath it compresses. Underneath that, the muscles themselves literally deform. But the most critical damage, that happens within the enormous network of microscopic blood vessels buried beneath your skin, which we call capillaries. Normally, you can think of these capillaries like neat, highly efficient little water pipes, letting blood flow smoothly. Now, imagine taking a hammer and striking hundreds of those delicate, tiny pipes all at once. They're suddenly squeezed completely beyond their physical limits. Some of them manage to survive the shockwave, sure, but many, many don't. They just burst instantly. Now, we have a real problem, because blood has a very specific place it belongs, right? Inside those vessels. But with those tiny pipes suddenly shattered, the blood has nowhere to go but out. The red blood cells violently leak into the surrounding tissue. They spread erratically through all those microscopic spaces between your fat, your muscle, and your connective tissue. So now your body has a localized crisis on its hands. It's not like you've lost a dangerous volume of blood overall. The real issue is that the blood is now trapped in a place where it should never, ever be. Section 1. Vasodilation and the swelling. This brings us to the immediate chemical distress response, which is the exact reason that injured cheek begins to rapidly puff up, honestly, before you even have time to ask for an ice pack. So, a truly fascinating biological concept kicks in right here: vasodilation. Within mere seconds of taking that hit, a massive biological alarm goes off in your body. The damaged cells at the impact site basically start screaming for help. They release these really powerful chemical signals that rush over to the nearby surviving blood vessels and essentially shout, "Hey, we've been injured over here." In response, these surviving vessels undergo vasodilation, which basically means they deliberately widen. They open up to let a rush of extra blood arrive at the scene to help. But at the same time, the vessel walls purposefully become leakier. This allows specialized inflammatory fluid to escape out of the vessels and flood directly into the damaged tissues. So here's the crucial point. When you actually touch that growing bump on your cheek, you are feeling three very specific things combining all at once. First, you've got the raw blood that escaped from those initially broken vessels. Second, you have that massive rush of extra inflammatory fluid that arrived because of the vasodilation we just talked about. And third, you have the surrounding tissue itself, which is now physically swollen from absorbing all of this. It's a perfect storm of fluids, and that is precisely why your cheek is now puffing up into a highly noticeable, frankly quite annoying lump. And yeah, of course, it hurts a lot, but the pain isn't just some lingering echo of the elbow hitting your face. The physical swelling is now aggressively stretching the surrounding uninjured tissues, which triggers your mechanical pain receptors. But there's also an actual chemical warfare of pain happening under there. Those inflammatory fluids carry substances with names like bradykinin and prostaglandins. Their one specific biological job is to aggressively activate your pain receptors. It's basically your body's incredibly effective way of shouting at your brain, "Do not touch this, do not use this, just leave it alone until I can fix it." Section 2. Bruise versus hematoma, spotting the difference. This brings up a really important distinction because exactly how that blood pools dictates what kind of injury you're actually dealing with. People use these two terms interchangeably all the time, but structurally, they are vastly different. This brilliantly illustrates the mechanics under your skin. Take a look at the left side here, a standard bruise, or what doctors call a contusion. This is diffuse bleeding. The blood just spreads out evenly through the tissue. Think about pouring water onto a sponge. It just seeps out in all directions, creating a wide, flat, discolored patch. But a hematoma on the right side? That is a completely different beast.
Instead of spreading out nicely, the blood collects and pools in one localized pocket completely outside the blood vessels. Imagine taking that exact same water, but pouring it directly into a rubber balloon instead of a sponge. It fills up, it creates pressure, and it forms a distinct, firm lump beneath the skin. That concentrated balloon of trapped blood is a hematoma.
Now, let's apply this logic to one of the most famous visible injuries out there, the black eye. If you take a hit anywhere near the eye, why does it always look so incredibly dramatic, even if the punch wasn't really that hard? Well, it all comes down to geography. The skin around your eyelids and your eye socket happens to be some of the thinnest skin on your entire body. Because there's so little tissue density right there, even a truly microscopic amount of leaked blood from a tiny ruptured vessel will spread incredibly far and become super visible. Literally, a tiny leak creates a massive visual canvas of discoloration. This whole process is exactly why the very first thing someone hands you after a hit is a bag of frozen peas or an ice pack. Applying ice shortly after the injury triggers the exact opposite of that vasodilation process we talked about earlier. The cold forces your blood vessels to rapidly constrict. They tighten right up. By physically narrowing those pipes, you restrict the blood flow to the area. Less bleeding occurs and, crucially, way less of that inflammatory fluid leaks out. Now, obviously, ice can't magically remove the blood that has already escaped into your tissue, right? But it's an incredibly effective tool for shutting down that vasodilation process, limiting any extra bleeding, and putting a hard cap on how bad the swelling gets. Section 3. Chemistry of color. Why bruises change. So as the days pass, the swelling might finally go down, but the injury suddenly puts on this vivid, multicolored light show. The reason your skin transforms into an absolute rainbow over the next week is actually one of the most fascinating parts of human biology. Right after the injury, the fresh blood trapped under your skin is bright red, just like it is inside your veins when it's oxygenated. But because this blood is now trapped completely outside the circulatory system, the red blood cells are totally cut off from their fresh air supply. They quickly lose their oxygen. And as that oxygen leaves the trapped cells, the blood rapidly darkens. It shifts into dark blue, purple, or even a deep dark violet. This, by the way, is exactly why a bruise often looks way more terrifying and severe the morning after the injury than it did when you actually got hit. But don't worry, your body isn't just leaving that deoxygenated blood there to rot. Within hours, your immune system dispatches its elite cleanup crew. White blood cells flood the area, but they aren't there to fight off a bacterial infection. These first responders are specialized cells called macrophages. You can basically think of them as the microscopic sanitation workers of your body. They show up, physically surround, and begin to consume and dismantle the escaped, dead red blood cells just to clean up the mess. And as these macrophages do their heavy lifting, they create a literal timeline on your skin. Those changing colors you see in the mirror, they aren't random at all. It is pure chemistry on display. When macrophages break down red blood cells, they release hemoglobin, which is the protein that carries oxygen. Now, hemoglobin is super rich in iron. As your body dismantles that iron-rich compound piece by piece to recycle it, the byproducts reflect completely different wavelengths of light. So the dark purple gives way to a sickly green as the hemoglobin is first altered. Then, as the iron breaks down even further, it turns a mustard yellow, and finally a faded brown in the final stages of recycling. You are literally watching a real-time chemical dismantling process right through your own skin. Section 4. The cleanup crew, restoring the tissue. Over the next few days, while you're just going about your normal life, a massive, silent construction project is wrapping up beneath the surface to restore the injured area entirely. Let's look at the teams involved in this restoration process. Your macrophages are still hanging around, tirelessly cleaning up the last of that cellular debris. Meanwhile, your lymphatic system kicks into high gear, acting like a biological drain to carefully siphon away all that excess inflammatory fluid and bring the swelling completely down. Down at the tissue level, you have specialized cells called fibroblasts, and they're rapidly spinning brand new connective fibers to patch up the torn muscle and fat. And incredibly, your body actually begins growing entirely new capillary pipes to replace the ones that were shattered by the initial blow. Everything is working perfectly in sync to erase almost every physical trace of the trauma. Now, for the most part, this biological process is totally flawless. Most bruises and small hematomas are just going to heal entirely on their own. But there are crucial times when this totally normal process tips over into a severe medical emergency. What happens if the blood can't escape, the bleeding doesn't stop, and the pressure just keeps building? This is particularly critical when dealing with head injuries. Remember our balloon analogy for a hematoma from earlier? Well, if a hematoma forms inside the skull, it has a major problem. The skull is made of solid bone. It cannot expand, period. If blood continues to pool and fill that balloon inside the skull, the rising pressure has absolutely nowhere to go except inward, directly compressing the soft, delicate tissue of your brain. The external lump might actually look completely minor, but the internal pressure is rising dangerously fast. That is exactly why if a head injury is followed by a loss of consciousness, repeated vomiting, an excruciating headache, or increasing drowsiness and weakness, it is a massive red flag. These are signs of extreme neurological distress, and they require immediate, urgent medical assessment. Don't mess around with that.
So the next time you take a bump, a hit, or a stray elbow during a football game, take a second to appreciate what's actually happening. A bruise isn't just some ugly mark or simply blood under the skin. It is the highly visible evidence of a massive, frantic, and brilliantly coordinated microscopic construction project. The vessels break, the alarms sound, the fluids rush in, and the immune cells clean up. Every purple mark, every swollen lump, and every fading yellow hue tells the incredible story of a body that has taken damage, and without you even having to think about it for a second, is already hard at work healing itself. But honestly, it makes you wonder, if your body orchestrates a response this unimaginably complex just for a stray elbow, what other microscopic miracles is it performing right now while you're just sitting there listening to this?